Hi everyone, I'm Dr. Basrin, and today I will be talking to you about preconception counseling. This is basically to cover topics such as what to eat, what kind of measures to take, when to see a doctor, and hopefully how to prevent yourself from even getting to a point of needing to see a doctor. So number one, first and foremost, we recommend that all women start prenatal vitamins 3 months before conceiving. If you forgot and you're already pregnant, no problem, just get started now. The reason preconception time is so important for these vitamins is really for the folic acid component. Folic acid is really important for neural tube development, and we want to make sure that baby has enough. If you also have certain medical conditions and are taking medications, certain meds can impact your ability to metabolize folic acid. They can also impact your intake of iron, B12, thyroid hormones, and so always do a medication review with your family doctor if you regularly take any medications. Outside of that, we recommend smoking cessation for both partners because it can both impact the ovulation, the egg itself, as well as the sperm. Outside of that, avoid alcohol because you never know when you're getting pregnant, and so that can impact baby. And we don't really have studies to say what is too much or too little. Also want to remind everyone that stress management is a part of lifestyle management. So this means exercising regularly, having open communication with your partner and family, making sure everyone's supportive, and making sure you're getting sleep, meditation if that's what you need, and everything to really optimize your mental health. What we know is that hormones can be impacted by our mental health, and you can have difficulty ovulating and essentially skip periods, making it very hard to get pregnant. Once we've optimized our lifestyle, the next step is to talk about the timing of intercourse because this can significantly impact your chances of getting pregnant. Using the average of 28 to 32 days being most people's cycles, what we know is between day 14 to day 18 is when we ovulate. This means that if day 1 is your period, day 14, 2 weeks after that, to day 18 is when you might ovulate if you're between that 28 to 32 day cycle. The safest and less complicated way of doing this is if between day 9 from your period to day 18, you basically have intercourse every other day or essentially 3 times a week, you're pretty much going to catch any ovulation. Sperm can last for a few days, and so typically that every other day to every 2 days is a good timing to make sure that the sperm is there when ovulation happens. Other things that we think about to time our ovulation and intercourse is to look at our cervical mucus. As you know, the vaginal discharge changes throughout our period cycle, but what's most important is around the time of ovulation, it becomes that clear, sticky, egg white consistency. This means that you're probably ovulating, and so it's a good time to have intercourse. Another thing that some women want to do is look at LH surge strips. What this means is that there's a hormone called luteinizing hormone, or LH, that peaks just 24 hours before ovulation. And so if you find that you've reached that point, you know that ovulation is coming next, so a good time to have intercourse. Outside of that, some people can monitor their body temperature. Again, very finicky and can be tricky to track, but our body basically increases in temperature by 0.5 degrees Celsius around the time of ovulation. When do you want to see the doctor? So let's say you've been trying to conceive and it's been a year and you're under the age of 35, that would be a good time to see your doctor about in that 1 year period. If you are 35 and above and it's been 6 months of trying and no luck, then definitely see a doctor right away. For men, we definitely recommend seeing a physician if you're 40 and above to check your sperm quality with a semen analysis that is done. If you're under 40, and again, you and your partner are having difficulty in the same parameters I just described, then see a doctor sooner. Outside of that, what I would also recommend is for those who have irregular periods in general to just see a doctor from the get-go, because we might want to check your thyroid, check for other causes that may be amenable to treatment as well before you even try going on this journey. as always, I'd like to encourage you to speak to your family doctor if and when there's any confusion. And I hope that this talk is a general reminder for everybody to stay focused on looking at your health, being healthy, and taking charge of your own health as always. Take care. Bye.